Hey YouTube, my name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. Welcome back to my channel. And in today's video, we're going to talk about gender dysphoria. But before we go into the criteria that need to be met in order to diagnose gender dysphoria, I want you to understand that this particular condition, this diagnosis, there were several advocacy groups who suggested that we should not include gender dysphoria in the DSM-5. However, it was added, so we're going to talk about it, and I'll give you some of the criteria, symptomology, and so forth. So without further ado, let's talk about gender dysphoria. So according to the current DSM-5 criteria, people who persistently feel that they've been assigned the wrong biological sex and a gender change would be desirable would be consistent with a diagnosis of gender dysphoria. So, however, as I mentioned in the intro, this diagnosis of gender dysphoria is controversial. So many people believe that the transgender experience reflects an alternative, not pathological way of experiencing one's gender identity. So those people are advocating that gender dysphoria should not have been included in the DSM-5. It's about overly pathologizing different lifestyles. On the other hand, there are other people who believe that gender dysphoria is indeed a medical problem and it can produce personal unhappiness. And not to say that it produces personal unhappiness in everybody, but it can produce personal unhappiness. Thus, adding this diagnosis, gender dysphoria, would be helpful to allow these individuals to have access to healthcare. So there are these, polar opposite positions and a lot of fighting in the professional literature. There are still, even the language that's used to describe gender dysphoria, there are many advocacy groups that we're bothered with. Now, so what are the criteria? Well, for at least 6 months, so you're seeing once again that this is a chronic condition, a person's gender-related feelings and or behavior is at odds with his or her or their assigned gender. And it manifests in 2 or more of the following features: feelings that feelings or behaviors that contradict their primary sex, secondary sex characteristics, a powerful desire to eliminate one's sex characteristics. Are people who look at their genitalia and loathe it. A powerful wish to be a member of the opposite gender, yearning to be treated as a member of another gender, a firm belief that one's feelings and reactions are those that characterize another gender. So you don't need all of these, but if you have 2 or more, you're seeing gender dysphoria. And this has to cause some level of distress or impairment, right? Now, I went through the DSM criteria. This criteria is for adolescents and adults. There is a childhood version as well. I left that one out for the time being because I think a separate video should be done on that. In terms of gender dysphoria in adolescence and adulthood, males tend to outnumber women or females 2 to 1 in terms of gender dysphoria. And because a person feels trapped in a body that doesn't belong to them, or they feel like they're trapped in the opposite sex body, there is a lot of anxiety and depression, and there can even be thoughts of suicide to try and reconcile this loathsome feeling of the self. So, as I mentioned, this disorder can emerge in childhood and disappear in adolescence. but in other cases, it can continue into an adult gender dysphoria. And there's discussions as to what's the source of this gender dysphoria. Many clinicians suspect biological origins, in particular, the hypothalamus, which is responsible for things like food, drink, sex, temperature, might be responsible for this. So there is a suggestion that there could be genetic factors, prenatal factors, brain factors. All of these are biological in nature. Now, in terms of treatment, many people with gender dysphoria do go into treatment to reconcile what's going on. And some individuals with this disorder go and change one or more aspects of their sexual characteristics. It could be through hormones. It could be a gender affirming or reassignment surgery. Now, I say gender affirming, but there is literature that uses the word reassignment. That's the medical term for the surgery, but it is gender affirming. Now, a person who has gender dysphoria might be part of the transgender community. And being part of the transgender community, I think it's important to explain that if you have a person who's part of this community, this individual may try and match their gender expression in many different ways. It could be as simple as changing their clothing and dressing into clothing that matches their, gender identity. It could be hormones. It could be top surgery, which is for breast, either to a mastectomy or to add an augmentation, or it could be bottom surgery, combination of the two. But a person can be part of the trans community no matter whether they get top and bottom surgery or not. The other thing I want to talk about the trans community is the concept of pronouns. And I'm a big proponent of calling people as they wish to be called. So we might engage in some form of bias if we don't ask people what their preferred pronouns are. So a person might use he, she, they. They might experience a desire to use multiple pronouns and say, this is okay. If you call me he or they, that's fine. If you call me she or they, that's fine. But if you don't know, it's possible that you might be trampling on a person's identity. So as it relates to gender dysphoria and the trans community, I wanted to bring that discussion about using appropriate pronouns into the mix. So that is, in a brief synopsis, what gender dysphoria is, how we diagnose it, and the degree to which people approach treatment and discussion of pronouns. So if you like this video, if you found it useful, give me a big thumbs up, click the like button, subscribe, click the notifications tab. And I read and respond to every comment. So if there was something particularly meaningful that you wanted to share or react to, please put it in the comment section and I'll certainly respond, because I want this to be a learning community, and that will help me fulfill my mission of making psychology more accessible. Well, until next time, take care, YouTube.